everyone, welcome to Ste Pharmacology Difficult podcast. I'm your host Dr. Radhika Vijay, MBBS MD, Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your mind, is pharmacology difficult? Lend your ears for a while and let in the magic of knowledge. So today I'm going to cover 10 pharmacology lessons that 2025 taught us. And you better keep this in your mind. It's a very informative and very interesting topic. Without any delay, let's get on to the first one. AI is no longer the future. I'm talking about artificial intelligence. It's no longer the future. It's the pharmacology present. The AI-powered drug discovery. It is not a novelty anymore. Multiple new molecules are entering the clinical trials. They are designed entirely by the AI platforms. So AI is not the future, but the present of the pharmacology. Second lesson, drug shortage. They can entirely disrupt the healthcare system. So one should be very, very careful. Critical shortages of the drugs like antibiotics, oncology drugs, they prove that supply chain pharmacology, it matters so much. And pharmacology is not only a science. This is the lesson we are learning. It is logistics, global politics, and economics also. You should be aware of these things. Lesson number 3. Antimicrobial resistance is not slowing down. It is accelerating. The new resistance patterns, they have emerged faster than ever predicted. Even the last line drugs, they face the pressure. What is the lesson of all these things and of this awareness and knowledge? Stewardship, it is not optional. Every prescription counts. Okay, so keep this in your mind. Next important lesson. Personalized medicine, it is the mainstream. Yes, more therapies, they require genetic testing before the prescription. From antidepressants to oncology. The key takeaway, one size fits all. That era of the drug is now ended. Be careful. It's the era of the personalized medicine. Second, next lesson. Polypharmacy. It's a silent threat. There were several high-profile cases of adverse drug events due to multi-drug regimens, especially in the elderly people. And we are always reminded and we learn from such incidences that de-prescribing is an essential clinical skill you need to learn. Every physician needs to learn de-prescribing. Next important, lesson number 6. Lifestyle drug interactions, they are more serious than we could ever realize. Now this year saw a lot of warnings like grapefruit statin interactions, herbal anticoagulant interactions, alcohol, metformin, risks and interactions. What is the lesson we are learning from all these interactions and risks? The patient counseling, it is as important as the prescription. So be careful. The history of the patient, it matters so much. Lesson number 7. Injectable and long-acting drugs, they dominated the whole year. From long-acting antipsychotics to weekly GLP-1 agonist, long-acting formulations, they are the stars of this year. Pharmacology is shifting from take daily to less frequently but smarter drug therapies. So you should be aware of this fact and lesson also. Lesson number 8. Drug safety surveillance. It saved lives. This year, we saw there were several recalls due to contamination, impurity risk, adverse event spikes. What is the message all these events and incidences they are giving to us? Pharmacovigilance. It is not paperwork anymore. It is patient safety. One should be aware of that. Next important lesson. Weight loss drugs, they reshaped the pharmacology. They were much in vogue throughout the year in headlines, in clinics, in shortages, in controversies. GLP-1 receptor agonists are everywhere. Lesson number 10. Pharmacology education, it must evolve. Students demanded more clinical relevances, more digital tools, less rote memorization, And rightly, pharmacology training must include the AI basics, AMR stewardships, real-world prescribing patterns, and critical appraisal. This year taught us next generation of the pharmacologists need new and updated skills. So these were the 10 important lessons 2025 taught us about pharmacology. What are your views about this particular video? Please let me know in the comments. Till the next time, thank you, take care, bye-bye.